day everyone, this is Christine Meloritu, student nurse of BSN 2A1 of Southwestern University of Finland. And for today's video, I'm going to demonstrate on how to insert a catheter into the woman's urethra. What is catheterization? Catheterization is a process of inserting a catheter into a body cavity. It is usually used when people have difficulty voiding naturally, and it could be used to empty the bladder before or after a surgery. But before performing the procedure, we need to verify first the physician's order if that patient is the one that we're going to insert the catheter. We have here the physician's order ordered by Dr. Marilu. The patient is Kate L. Kaloy, a 21-year-old patient and was born on May 31, 2000. She is currently occupying in the second floor, room 123. Patient care is a Foley catheter. Instruction: inserting a Foley catheter, a French 16 gauge. Start date, time, now. Stop the date or time, 7 days from now. So the patient has no signs or allergies to food and any latex product. Ordered by Dr. Marilu Lorato. After verifying the physician's order, we need to prepare the materials needed. So in the table, we have here a sterilized catheterization kit. So we cannot open this and we'll need to keep this sterilized. So it includes a iodine swabs, waterproof underpad, fenestrated paper or drape, a lubricating jelly, sterilized glove, 10 cc of saline-filled syringe. We have also here a French 16 catheter and a urine bag. And after, we have here an alcohol, so this is used for hand hygiene, a pair of surgical gloves, it is a sterile gloves, and then a perineal pad. And we have here a container also in which we're going to put here our lubricating jelly and the tip of our catheter. Good day, ma'am. Please allow me to put these materials here on your bedside table. Thank you for that, ma'am. Good morning, ma'am. I am Nurse Christine, your nurse for today. May I know your name, please?
Kate L. Kaloy.
Your birthday?
May 31, 2000.
Okay, thank you for that, ma'am. I am here because Dr. Marilu ordered you for a catheter insertion since you're not able to void naturally since last night because of your urinary retention. So this procedure is a bit discomfort, and as your nurse, I'm trying my best to lessen the hurt, and I want you to trust me. Do you trust me, ma'am?
I do.
Thank you for that. I'm glad to hear that. But before we start, I'm going to ensure you first a privacy while performing this and provide you a good light. I'm going to switch this light first. Okay, thank you for that, ma'am. But before we start the procedure, may I know if you have any allergies to food?
No.
Or any latex product?
No.
Iodine?
No.
Oh, thank you for that, ma'am. That's good to hear. I'm going to place you first in a comfortable position. Okay. I'm going to raise your drape. And could you please extend your leg? Okay, so let us just imagine that the patient is flexing her leg. And can you please, okay, thank you, so that we can able to see your perineum. So again, let's imagine that the patient is flexing her leg slightly apart. We will start in a minute, and I'm going to don my gloves first. But first, I'm going to perform hand hygiene. Get the pair of sterile gloves and making it sterile filled. Okay, I'll be inserting first my non-dominant hand, which is my left hand. Next will be my right hand, my dominant hand. So I'll be now fixing the gloves. Okay, it's done. We can now proceed to cleaning with your perineum. So I'm going to throw this first. So we'll be using this perineal pad. So it's a bit cold, ma'am. You might feel discomfort. Okay. I'm going to perform this 3 times. So I perform it first in your major labia, next in your minor labia. Then throw it. And lastly, in your meatus. Okay, in that inner part or the center part. Okay, throw it. So we are now done. I'm going to set this aside. And I will remove my gloves now. Okay, I'm going to get my catheterization kit. So this is a sterile one. So, but before I'm going to open this, I'm going to put my last pair of sterile gloves first. So I'm going to set this aside and still maintain a sterile field. So same procedure, I'm going to insert first my non-dominant hand. Next will be my right hand, which is my dominant hand. And fix this so I can wear it properly. So it's good. So I'm going to throw this. And next I'm going to get this kit and open it. So it contains here the stuffs that I'll be using to you. Place it here. So I have here my iodine swab and I'll be using this later. Okay, I'm going to pick up first the waterproof underpads. Ma'am, can you please raise your hips for me? Okay, thank you. And I'll be inserting this under your buttocks to absorb wetness. Thank you so much, ma'am. Next, so I'll be putting this fenestrated drape over the hole, over your hole. Okay, that's good. Next, we're going to get this saline-filled syringe and the catheter and the urine bag. So let's unpack this and dispose this one. So this will be the catheter that we'll be using. It is a gauge French 16 catheter. So I'm going to remove this one, throw it, then I'll be putting the syringe here. So after we successfully insert the syringe, so we're now going to check for the drainage bag if it is clumped. So it is clumped so that the urine will prevent from leaking. Next, we're going to get this container. So it is for the lubricant jelly. So we're going to put 2.5 to 5 inches of it with the lubricant jelly, so it will be easier to insert, and put it aside. And now let's move on to the insertion. First, I am going to use my non-dominant hand, which is my left hand, and I'm going to identify the meatus and retractor labia. So this one, I've already found it. And next, I'm going to hold this position throughout the procedure. So I'll be placing my left hand here in your meatus. Next, I'm going to use my sterile dominant hand, which is my right hand, and I'm going to clean your meatus with antiseptic solution, which is the iodine swab, this one. Okay, it's good. So I'm going to dispose this. Okay, ma'am, we're about to start, and I'm going to pick up the catheter using my dominant hand and keeping my non-dominant hand in your perineum so that I'm going to retract your labia. So I'm going to insert this now. Okay, please take a deep breath for me. Okay, I will advance 1 to 2 inches more. Okay, I can see some urine flowing now. Thank you for that, ma'am. I'm holding the catheter with my non-dominant hand and going to inflate the balloon using the saline-filled syringe. And remove it. Okay, I'm going to dispose this. So the catheter is now placed and I'm going to pull force resistance. Okay, that was good. So it was properly placed into your bladder. Okay, ma'am, that was good. I'll be putting this urine bag first here in your bed frame, making sure that the tube is not kinked. So there will be a good urine flow, and always look for the good attachment of this. So I installed it properly and making it sure not to rest on the floor. So after it, I'm going to get your drape. This one is the drape. Okay, and also your underpad. Can you please raise your buttocks or hips with me? Okay, thank you, ma'am. You may now put down your legs. Okay, thank you. And I will be attaching these straps onto your legs so that the catheter will not move or you will not feel discomfortable. Okay, that was good. I'm going to put down your blankets. Since we're already done, so I'm going to dispose and clean up the mess first. Next, I'll be removing my used gloves and put it in the trash bin. Okay, we're all good now. Ma'am, thank you for your cooperation for today. And if you have some concerns or emergency, you may ring this bell here beside you. And I'll be in the nursing station only. Thank you so much, ma'am, and have a good day. Goodbye.
Thank you so much, nurse, for helping me. I am glad. Goodbye.
Lastly, perform hand hygiene.
Documentation.